Hello and welcome to the News by Standards. Junior doctors in England will strike on the 13th, 14th and 15th of March, the British Medical Association has announced. They want a pay increase to make up for 15 years of inflation. The BMA says junior doctors have been left with no choice after the Health Secretary refused to attend a meeting to negotiate on pay. Downing Street said the strike action was disappointing, and Steve Barclay had recently met the union to discuss what was fair and affordable. The 3-day strike, starting and finishing at 7 o'clock, will see junior doctors walk out of both routine and emergency care. But by law, they can only withdraw from life and limb emergency care if the NHS has found other staff to cover for them. The term junior doctors covers everyone who has just graduated from medical school through to those with many years' experience on the front line. Overall, they account for more than 40% of the medical workforce. Nearly 48,000 junior doctors working across hospitals and in the community were eligible to vote in a recent strike ballot, with more than 36,000 voting for action. The BMA union says junior doctors are demoralised, angry and no longer willing to work for wages that have seen a real terms decline of over 26% in the past 15 years. They said this, together with the stress and exhaustion of working in an NHS crisis, had brought them to this moment. We have not been told why we have not been offered intensive negotiations, nor what we need to do for the government to begin negotiations with us. We are left with no option but to proceed with this action, the BMA Junior Doctors Committee said. Mr Barclay said it was deeply disappointing that some union members had voted for strike action. Ministers say junior doctors' pay had increased by a cumulative 8.2% since 2019 to 2020, and a higher pay band had been introduced for the most experienced staff, and rates for night shifts increased. The last time junior doctors went on strike was in 2016 over a new contract that had been introduced. During the 2016 strike, consultants stepped in, but this meant a huge amount of pre-planned treatments, such as knee and hip replacements, had to be cancelled.